Hi, I'm Dr. Sunil Richardson. I'm a maxillofacial and a craniofacial surgeon. I practice out of South India and also out of Muscat in the Middle East. We're waiting for the anesthesiologist before we can start off this patient with rhinoplasty. So in the meanwhile, I thought I would tell you some facts about rhinoplasty. So what exactly is rhinoplasty? Rhinoplasty is any surgery or any plastic procedure or any reshaping procedure that we do on the nose. So the nose is a very typical part of the face, It sits right there in the center. It's really vital in aesthetics and also in function. Now, it also has bone, cartilage and soft tissue in the form of skin and mucosa inside. So it's a complex unit and it has to be in perfect proportion and aesthetics for the face in order for a face to be called beautiful. Now, if you look at it historically, it was a very famous Indian Ayurvedic surgeon who described the forehead flap. He was taking tissues from the forehead and reconstructing the nose per se. That's called the Indian flap. That I think is the earliest documented evidence of rhinoplasty. However, in today's context, most of the rhinoplasties or the nose jobs that we do are subtle procedures. We would want to get the tip a little bit up, you want to get the nasal base narrowed, you want to get something on the dorsal, or this is the central part of the nose, get the width reduced. So all of these things basically add on to the aesthetics, but then there's also the big problem of function. We have this breathing function and smelling function through the nose. And right in the middle of the nose, there is a bone and cartilage combined, which is called the septum. Now, this septum is very, very essential that it be in the midline, at least not obstructing any one of the layers. So very often we see that this septum moves to either one of the sides. This happens in a lot of patients with congenital deformities. It happens after an accident. And it just happens like that. Not a reason. A high percentage of patients have a mild degree of a deviated nasal septum or a DNS as we would call. But all of that doesn't necessitate treatment. However, when that has a nasal blockage, and then that needs a surgery to fix it. So very often we have patients with a combination of a functional issue and also an aesthetic issue. And we here at Richardson's, we are trained to take care of both of them at a single time. And also we have now, for example, non-surgical rhinoplasty, which is like a temporary which are fillers. We're mostly specializing into permanent rhinoplasty, which means that once we sculpture and get the nose, that's going to be the same for the patient for the rest of their life. There are many surgeons across the world and also in India who claim themselves to be facial plastic surgeons, aesthetic surgeons, cosmetic surgeons and so on and so forth. There are so many specialties who train themselves in rhinoplasty. Plastic surgeons for one, maxillofacial surgeons, ENT surgeons and even other surgeons who have got themselves trained in this art and science of rhinoplasty. Rhinoplasty for the surgeon is not just anatomy and science. It's a little bit more than that because there is a lot of art involved, and we refer this art in a word called finesse or whatever you would want to call, but this is individually specific to that surgeon because it depends on how correctly or how suitably the nose is molded and shaped for that particular face. Now, as a person who's seeking rhinoplasty, one of the first things you would want to know is the amount of experience a surgeon has. There are, in this social media savvy world, people who would just get a couple of pictures and bloat it up, magnify it, but they would have just done a handful of surgeries. So it's very essential to know that the surgeon you're going to is really experienced, not in terms of the age, but in terms of the number of surgeries he's done. This is so important because this is a surgery with finesse. We say rhinoplasty is a surgery of millimeters, and so therefore every millimeter counts. That's one of the first things you want to know. So you want to probably look at the surgeon's background, how many surgeries are being done, maybe ask the surgeon to show some similar results. And of course, after that, you can also do the predictable tracing to know how exactly your nose is going to look at. We also have this closed rhinoplasty, open rhinoplasty, and That decision is generally made by the surgeon. However, whenever we plan to do an open rhinoplasty, we tend to look at the whole nose, the bony part, the cartilaginous part, and the septum and the soft tissue. So whenever a major work has to be done on the nose, it's better we do an open structure rhinoplasty. There is, however, no real rule. It depends on the expertise and the experience of the surgeon. Now, what is a typical experience of a patient who undergoes rhinoplasty at Richardson's? Some of them could go overnight, so it's a daycare procedure. When you do a small hump reduction, or you just want to do an AR flare correction, that's probably a few hours of being at the hospital. But on the other extreme, we also do reconstructive rhinoplasties with rib harvesting or with other sources of allograft materials, wherein the patient might have to stay up to 5 to 6 days. This is because in these patients, we contour, modify, augment or decrease the bone, the cartilage and the soft tissue. When so much of procedure is done, then the hospital stay increases. As I've already mentioned, it could be from a few hours to a few days of hospital stay. The cost involved could also be likewise. So you could get it done for a few thousand rupees and it could go up to a few $1,000s. So that's the kind of cost you're looking at. And the cost for rhinoplasty typically depends on what needs to be done and what is the time that it would take, the expertise involved, the hospital stay, medicines and everything else. The other question people ask me a lot of patients are in doubt. What's the best age for rhinoplasty? Now, what I tell is this: if the patient has a functional issue, if they have a problem with a blocked nose, I think you don't have to wait long, because that's function. Function takes precedence to aesthetics, and therefore you can do it at a younger age. And we tend to call those kind of work as anterior or just a partial rhinoplasty, wherein the blockage is relieved and whatever little aesthetic improvement can be done will be done. However, it's not a comprehensive total rhinoplasty, as I would like to call it. Apart from that, after the end of growth, which is like about 15 years for girls and 17 years for boys, you can do the definitive complete rhinoplasty. This is done, as I mentioned, mostly by open technique, but we can sometimes do a closed rhinoplasty as well. There is a lot of preparatory work that goes towards rhinoplasty. One of the first things we do is take good quality photographs. Photographic analysis is a must. You got to have a room dedicated for this, so that good quality basic photographs can be taken. These photographs can be assessed later on when the patient is not there. The second most important thing is, which cannot be overstated, is the discussion that the surgeon needs to have with the patient, because both of them have to be at the same page. Sometimes the patient's expectations are way too much. The surgeon, I for instance, always tell the patient that, look, this is what you can get. Or sometimes the patient doesn't realize that this could be got, so I'm going to educate them. I'm saying, okay, so you have got blocked nose, but we could also get this done for you. So it's a rapport that you build with the patient, and you also have to do some basic tests, run all the blood tests and everything. Whenever I'm doing a revision rhinoplasty, whether it be a secondary or a tertiary or a quaternary or so on and so forth, which means a rhinoplasty has been done before, that's called a revision or a redo rhinoplasty. I like to take a cone beam CT scan or a CT scan. This is because I would want to know what exactly the earlier surgeon has done. Has some septum been taken? Is the osteotomy alright? What is happening to the septum inside? So otherwise, you may not want to take a CT scan for every patient for a primary rhinoplasty. But it's our mandate here that when the patient especially comes for a revision or a reconstructive rhinoplasty, I always ask them to take a cone beam CT scan. It just takes a few minutes and you get that much more information before we start the procedure. What about post-operative care after rhinoplasty? This is also a major concern for patients. With regards to diet, there's no restriction. That's what I tell my patients. Because we're operating in the nose and the mouth is open and free, you can eat what you want most of the times. But we tend to block the nose for a while, either with some silicone plates or with some packs. And so therefore the first 2 days can be a little difficult when you're doing a rhinoplasty with a septoplasty. There's no much pain, but usually there's some puffiness, some blocked nose. We also put the patient on some anti-histaminic drugs. So some of them can feel a bit drowsy, sleepy, malaise and stuff. But from day 3 onwards, that's really quick healing. Patients go home usually on day 3 or day 4. Once they go home, a lot of them will have a splint on the nose. We sometimes use thermoplastic splints, or these splints are set in hot water, or rather they melt in hot water and set in cold water. Or we use plaster of Paris splints like how we used to do before. Or we can also use splints that are stuck on with glue or with gum. Whatever be the splint, these splints we advise our patients not to touch them, not to handle them. They got to keep it the way it is, come back to us for the review day and we will take care of them. But a lot of them will get those splints, and that means that they probably cannot go for a function or a social event in the first week after surgery. Apart from that, patients can also get some bruising around the eyes because you do the osteotomy on the nose. Bruising can come a little bit on the left side. Can also have some subconjunctival ecchymosis, very small percentage of patients. The fairer the patient, the more these things are visible. So for example, someone with my color, you're not going to get much ecchymosis, especially around the eyes. But then that's also something we tell the patient, especially when we do the osteotomy. So these are the main concerns that patients have after surgery. I would recommend people to take a week to 10 days off when you're having a major procedure. I mean, it's a minor procedure, a day or two is enough. So whatever be it, it's not going to be more than 10 days. And so by about 2 weeks, they're good to go back to school or work or whatever.